Hey, everybody, excited about our upcoming episode where we talk about Billy Joel, Bruce Willis, and what is going on with them. We have guest Dr. Lisa Cook explaining some of their neurological illnesses. Check it out. Lisa Cook!
Hi, good morning.
It's been a zillion years, Lisa Cook.
It has. How are you?
I'm good. Welcome to Gross Anatomy, Lisa Cook, where we explore the sights, smells, and sounds of medicine, how it relates to movies, TV, books, pop culture, and the world around us. And I am Dr. Jason Cohen.
I am Lauren Taylor. And
And
today
who
we
we got today, Lauren Taylor?
a very special guest, a neurologist, which we've been trying to have on for a while. And we're so happy she can join us today, Dr. Lisa Cook.
Good morning. Thank you for having me.
Yeah, blast from the past for me. Blast from the past.
Well, explain that. Explain how you two know each other for our audience.
How do we know each other, Lisa Cook?
Just through Cedars. I started out in practice in 2015, I think. Yeah, around that time. And I was hustling and working at the hospital a lot, and I met Jason at the time.
Yeah.
Yeah.
It was back in the day when it seemed like we were always at the hospital. That was kind of, for me, that was actually probably for you too. I mean, for my first 10 or 15 years of practice, I was always at the hospital, like all the time. And there were groups of people that we would just always see. You'd always see those people. And you were one of those people that, you were kind of our go-to neurologist all the time for inpatient crap.
Yeah.
Well, explain that to someone who's not a doctor like me. So you guys, would you sometimes work on the same patients? Like someone would come in for like thyroid and actually have like a neurological problem, or how does that work?
Yes, exactly. So people come into the hospital for, various reasons. And if they have a neurological issue or a question where they're altered, or, they might have some stroke symptoms or something that may look like a seizure, then they'll call neurology to consult. So we're the consultants. We'll come and see the patient and offer our assessment.
No, Lauren Taylor, like back in the day, when young practitioners are starting often, unless you kind of like are lucky enough to walk into like some big established practice of doing like a specific thing that you were hired to do, most of the time when you start practice, you kind of, try to make yourself available for anything and everything. And especially if you're hospital based. And so that was for me, it was kind of towards the end of my being available for it. So I did a lot of just general surgery, sick people with surgical problems. And Lisa, I imagine, Dr. Cook, you were just also trying to hustle and build a practice. And so that's why we would see each other all the time, because we'd kind of just be there. We'd deal with emergency stuff. And you were kind of, for a while, we would be there all the time.
It's just being available and answering calls and being able to go to the hospital on a daily basis, sometimes twice a day, to see patients that need to be seen.
Mhm.
So, and it's a good way to also meet other doctors, get to know, other people. So you see them face to face. And I think at the time, we were all relatively young. So it was nice to kind of,
You were
have
young.
that camaraderie. Yeah. So now everybody is kind of, we're in our own offices. We've got a busy outpatient or surgical practice. And so it's definitely less of that. I don't do very much of it, although I am on call this weekend. But yeah. Nice. So I've moved away from that inpatient practice, just because you want a little more control of your lifestyle. You don't really necessarily want to go in on nights and weekends.
Mhm.
So it is nice to have an outpatient practice of patients that you build relationships with over time and have that kind of setting.
That's a good thing that we don't see each other in the hospital anymore.
Yeah.
Well, what made you want to go into neurology? Because I feel like that sounds like the hardest of the practices, the specialties.
I mean, I think the brain itself is an interesting organ. It's an enigma. And I thought I really enjoyed it when I did my rotation. First of all, it's kind of like detective work. You have to hear a story and sort of put pieces together to try to come up with what you think is the most likely diagnosis. I took a year off after, or actually in between medical school and my third and fourth year, and I did, some more research. I was at UCSF up in San Francisco, and I think it just opened my eyes to different types of neurological diseases. We did research in certain forms of dementia, Creutzfeldt-Jakob's disease, which is similar to mad cow, and frontotemporal dementia. And so you could
Wait,
see.
you can't just say that kind of word and thing and
Sounds
not
very
explain
gross anatomy.
what the heck. You can't just go there and not explain what the heck you're talking about.
Okay, like Creutzfeldt-Jakob is like mad cow. It's where basically, you develop this prion disease where you have accumulation of this abnormal protein in your brain that essentially, takes over your entire body. And we saw these patients come in and just how sad, but also very interesting, and how the brain changes, how their personality changes, trying to identify what their early symptoms are, in hopes of one day finding, a treatment or a cure. And frontotemporal dementia, where certain parts of the brain degenerate. It's similar to Alzheimer's, but it's different in that it's different areas of the brain. And you saw also how even like their artwork and their paintings changed because, their personalities were changing. And so I just thought it was fascinating. You see your bread and butter every day in our offices where, patients have headaches, migraines, um, seizures, strokes, but every once in a while you see something that's fascinating. And I really liked the fact that, it's evolving. Treatments are evolving. The way that we treat strokes now than what we did 20 years ago is completely different. We're much more aggressive in administering treatment. And you'll see patients come in with devastating, where they lose function on half their body and they come in basically paralyzed. And we're able to offer them a treatment. And within, hours, they're essentially back to normal. So that was not a thing of, 20, 30 years ago. We were just making these diagnoses, localizing what we call localizing the lesion is where you identify what part of the brain that, is not working, and then you just move on and walk away. But I feel like nowadays we're much more aggressive because we have these treatments that allow us to be.
There's so much that you just unpacked, but have you actually ever seen a patient? Like, I learned about Jakob Creutzfeldt and mad cow, but I've never seen that. Like, I remember reading about it and it sounded cool. You've seen that?
Yeah, I mean, it's extremely rare. And I would say in my outpatient practice in the last, 15 years, no, I have not. But because I was at an institution that was bringing these patients in to do research on them and to, get serum samples like blood samples and cerebrospinal fluid samples. So I was able to see a number of patients at the time.
But I have a quick question going back to strokes. We had a guest on, Bradley Rose, and he was a Peloton instructor. And he had a stroke in his 30s, like I think it was his early 30s. Is that something you're seeing, like strokes in younger patients these
Yeah.
days?
It definitely is. I mean, it's always been a thing. There was, we always studied stroke in the young and coming up with other causes because it's not the usual things that lead to stroke, which is plaque disease in the brain, in the arteries of the brain. So, like high blood pressure, diabetes, high cholesterol, those are all risk factors for stroke. But in the young, there's a whole other differential of other things that can cause that, particularly if someone has some kind of like a heart defect, where they can have like clot that develops and then it passes through the heart and then up to the brain. There are like blood disorders where some people are just at higher risk for clotting.
Okay.
But it is something that we have seen, and I think as time goes on, we see it more commonly.
You mentioned also
No,
frontotemporal dementia, right?
Yes.
That's what Bruce Willis has, right? Supposedly?
Yes. Yes. Yeah, that's what he was diagnosed with. Yeah, FTD.
I had really never, it really was never in the public until Bruce Willis, right? You really never kind of,
Right.
Is it much? Is it not that common,
It's
or
it's not very common, no. So it's under the umbrella of dementias, with Alzheimer's disease being the most common by far. So I think we hear a lot about Alzheimer's, or a lot of people have a relative or someone they know that is dealing with Alzheimer's. And I think also, just because people are living longer, we're seeing dementias, occur, because the lifespan is much longer than it was in the past. And so the brain degenerates as time goes on. But FTD is one of those dementias that is much less common, and it happens more so in the younger. So it could 50s, 60s. That's a common presentation, and it's degeneration of the brain, but it's certain parts of the brain, where it's mainly in the frontal area of the brain, the fronto and temporal area. And the frontal part of the brain is what usually controls like personality and executive functioning, decision making, and things like that. So when you see degeneration, you see patients that have typically more like changes in personality, where their partner, their family member will say they're not the same as they used to be. I've seen some patients even have changes in like their appetite, or like they have certain like ways of doing things, almost like in an OCD type fashion. And they'll say, they were never like this before. They're almost like a different person.
yeah?
And they have less so like with Alzheimer's disease, where people have primarily problems with memory. Short-term memory is usually how it starts, but FTD is different, because it's mostly personality changes, that their memory is oftentimes preserved, especially early on, but they have changes in their, personality and decision-making processes.
And do
I'm
they
a big
also
Bruce
lose?
Willis fan. Are you a
Yeah.
Bruce Willis fan? Yeah. So I remember, they would post these videos. His family would post these Bruce Willis videos of him just kind of there, not talking, like that. It seemed like for him that was like a big thing. Like he lost the ability to speak, right, or
That was going to
communicate.
be my question too. Is it affects you verbally eventually, or how does that work?
I mean, it doesn't affect your speech per se, but I think because like their personality has changed, and then they do start having some cognitive issues too. And I mean, everybody's different, so I don't think it's necessarily that way, but I have seen people where, yeah, because of all of these things that are going on, like brain is just not the same. They do have sort of a muted personality, or they're just less, I don't know, less verbal, less interactive.
We have any idea how or why it happens, or just still no clue?
We don't know. We just don't know. Yeah. I mean, there's probably some genetics involved in it, but it is something that's just spontaneous. It's something that just, it just happens.
Is it
Yeah.
is it more common than we think, and Bruce Willis and his family have kind of brought it to the forefront, or is it still pretty rare?
It's not that common. Yeah,
Not
FTD is actually not very common,
got it. Wow.
especially in the realm of dementias.
Yeah. Huh. It's
Yeah.
amazing watching Bruce Willis and watching his family post stuff about him, because he was such a.
Yeah.
Well, another one I didn't know about was Billy Joel. He has NPH and he had to cancel his tour. Like, I don't know anything about what he has or what that means. Can you
Yeah, NPH, well, it stands for normal pressure hydrocephalus. And basically, it's a disorder where, for whatever reason, like you start building up this extra spinal fluid around your brain. I mean, everybody has this normal fluid that surrounds their brain. It sort of like cushions your brain. And whether it's a problem with, you think of like a sink that's full of water, and for some reason the drain's not working properly and the sink is running. So your body builds spinal fluid on a daily basis, on a daily rate, but for whatever reason it's just not draining properly. And so as a result of that, that fluid just kind of builds up, and then it creates this, kind of, it's just like the funnel. And so what happens is people can have difficulty walking as a result of it. They often have bladder issues, like bladder incontinence, and then they have changes in personality. So there's this acronym we used to use in the past that's it was wet, wild, and wacky. So they
Hmm.
had, the urinary stuff, the changes in personality, and then like the gait problems, the walking problems. It can be hard to diagnose because sometimes the findings are pretty subtle. Like you can see on an MRI scan when you do imaging that it does look like, the areas of the brain where there is fluid that surrounds it, it kind of looks pushed out and it looks enlarged because of this extra fluid. But it the diagnosis can be a little bit tricky because sometimes elderly patients have that anyways, and so you sort of have to look at the whole picture. And the treatment or the way that you go about diagnosing it is you take out a bunch of spinal fluid. So you either do it in, as an outpatient where you take out a bunch of spinal fluid and then you observe them over the next few days to see how much improvement they've had. And sometimes it's like day and night where we order this procedure and then we monitor these patients and they say the family's like, yeah, they were able to walk, they were complete, they were much better. And then over time, that fluid builds up again. And so their symptoms all come back. So if you are able to diagnose that, then the treatment is actually the surgical treatment where you put this catheter in and they funnel the catheter from the brain essentially to the abdominal cavity. And that excess fluid essentially just drains into their abdominal cavity. And then you just urinate it out. So for some people, it works really well, but there are cases where, either the shunt just doesn't work properly, there's a malfunction in the shunt, there's placement issues, there's infection, other things that can happen. So sometimes it can be a little bit tricky.
So, fun fact: as a resident, I did get to rotate on neurosurgery, so I actually had the
Oh,
chance to do a lot of those shunts.
oh, nice.
Yeah. So, I don't remember the brain part, but I remember you would tunnel this tube, this catheter, from the brain all the way down, and you tunnel it, and then you'd stick it into the abdomen, and it was a pretty fun, cool little thing that we did. I don't know if we did it specifically for that diagnosis. Maybe we did it but I guess we probably did, right?
Probably, yeah,
Huh.
probably.
And I it's for me, what's crazy is we just recently, I don't know how big of a movie, TV, pop culture fan you are, but clearly I'm and Lauren, we're huge. That's why we do this silly podcast. So like I had recently just watched the Billy Joel documentary. Did either of you guys see it?
Oh,
No, it's on
Did you
my
see
list.
it?
I'm
It's
gonna
no,
watch.
I didn't. Is it
it's
is it good?
really good. So we literally,
Oh,
and that's what was so weird. And we're watching it, and I'd never seen, and I'm a big Billy Joel fan, and I'd never seen him in concert. And I was saying to my wife, I'm like, we got to go see Billy Joel. We got to,
oh,
before it's too late. And then like a week later, this news came out, and I was like, what? And I'm like, we're having Lisa Cook as a guest. We could talk about this. It's perfect. We could cure Billy Joel, and so I could see him in concert.
yeah, we'd have to see. I mean, I have seen people really turn around and do quite well afterwards. And then there's also other people that don't necessarily because of age and other risk factors and things like that. So
So this is something that may end his professional career, you think, potentially? I may not be able to see him in
yeah,
concert. Look,
I don't know. I don't know. It's possible. I mean, you deal with something like that, and would you necessarily want to go on tour and
I don't know if I would want to go on tour either way at his age. He's like I think he's 76 or something, still
is
on tour.
he? Oh
Yeah.
my gosh,
Yeah.
yeah. I mean,
Yeah. Although I
yeah.
mean he's amazing, filling out stadiums and filling up stadiums. He in the documentary talked about how he had at least one suicide attempt, and then he had some crazy motorcycle accident where he nearly died. Do you think that potentially is or who the heck knows? Is that what might be what causing this pressure buildup?
I don't know, honestly. I'm not sure because I don't know what the timeline of it was. And
Years ago, as a
yeah.
young man.
Oh, no, no. I doubt it.
So
I
it's
doubt
not
it.
that good thing. Got it.
No, it doesn't usually happen after any trauma per se.
It's just
Um,
a spontaneous thing that for whatever reason the fluid builds up.
yeah,
And you
yeah,
said the other thing you said is just to explain. You said the way we diagnose it, we take the fluid out. That's basically a spinal tap, right? A lumbar puncture.
yes, it's a
Yeah.
lumbar puncture. Yeah, and sometimes we have to bring the person into the hospital just to monitor it more closely. Neurosurgeons will put in like a temporary lumbar drain, and every day they can actually take a little bit out. And we can monitor with physical therapy, getting the person up and walking and seeing how much they're able to do. It's just a kind of more seamless way of monitoring patients because some people, may not be able to tell or they're at home but they don't have good like a caregiver that can adequately assess them. So sometimes we do bring them into the hospital and we can titrate it a little more carefully to decide on whether or not the person needs to have a shunt.
Wow.
Well, it actually seems more optimistic than I thought. It does seem like there is treatment available that can work for people. So that's good. I mean, it's
Yeah,
compared to other
exactly.
things.
That's true. I mean, it's not like a devastating, you're going to die from this kind of disorder. It is something that could potentially be treated, but people can also be left with some, residual walking difficulty and other things. So,
Is
Okay.
the incidence of that on the rise, or not really? And Billy Joel, it's
no, I don't think so. I mean, maybe perhaps just because of age and, people living longer that we're just seeing these things pop up, but no, I don't think necessarily there's an increase in it.
so sad because I may not get to see Billy Joel now.
I
It's
know.
and and it's always been on my list. Have either of you guys seen Billy Joel?
Yeah.
No.
Yeah.
You
Yeah.
saw?
Yeah. He's been touring forever, Dr. Cohn. You really don't have an excuse not
I
to.
know. I know. When did you see him? How long ago?
I saw him growing up in Oklahoma. He actually came to Oklahoma with Elton John, and I saw them both.
You saw the Elton John Billy Joel? I
That's
remember that.
amazing.
I did
Oh
when I was a little.
man, Lauren Taylor, I hate you. No, I love
He's
him.
been he's been in LA so many times. You have no excuse.
I know, and he's got that residence in Madison Square Garden too.
Mhm.
Oh, yeah.
Well, there's another disease I want to talk about that seems to be worse is Parkinson's, and I know people personally that have it, and I was just wondering, like, are there new treatment options? And then I have a separate question. It usually happens to men over 60. Is that true? Or
Yes, that is true. It's much more common in men. It's 1.5 times more common in men than women. And it usually is, one of these diseases that happen as people get older. So typically 60s would be, kind of on the earlier age range, more common in 70s and 80s. Um, Medication wise, I mean, yes and no. There are new medications that are on the market. They're all very similar to the older medications. There's just different variants, long acting versions of the same drugs, essentially. I mean, Parkinson's has to do with a specific area of the brain that degenerates, and it's in the deep parts of the brain called the basal ganglia. And that structure of the brain is important in movement and function. So it's specifically like motor movement. You kind of think of like the Tin Man, if you don't have enough oil, it's rigid, like the walking and the movement part of it, where there's this rigidity and there's decreased movement.
I'm cutting you off for 1 second because I love the fact that you just did a movie reference, Wizard of Oz. So you get it. You get the whole pop.
Guess so.
Go back. I just wanted to shout you out for the Wizard of Oz. Very good.
Thanks. But if you think of it like that, there's just not enough of this neurotransmitter dopamine, which is what the basal ganglia produces. And because you have deterioration or degeneration of that part of the brain, as a result of that, you have decreased dopamine. You need dopamine for a lot of different things, but one of the things in Parkinson's is that movement. So as a result of that, people have these like on and off periods. And the on periods is when they're functioning and they're able to move. And the off periods are when there's there's a lack of it. And so there's decreased movement. Some people have like these freezing episodes. So as they're walking, like their body sort of suddenly freezes. And I have patients that come in initially and they talk about how they know what they're trying to do, especially in the morning when they get up, but they just can't like get their body to do it. So it almost feels like it's stuck.
That's heartbreaking. Yeah.
Yeah.
Is there
It,
truth to like Agent Orange being a factor in Parkinson's disease?
Yeah, so that's one of the reasons why we think that it's more common in men because they're exposed to various, toxins. And Agent Orange is the kind of the classic example where in the Vietnam War, because they were exposed to that, we did see a higher incidence of Parkinson's as a result. And then there's other chemicals and toxins like, depending on like their industry. But yeah, I do think that there is these environmental or occupational exposures.
Okay.
so the one thing about I still remember some of my stuff from med school. The thing that you were describing with Parkinson's is people have a hard time initiating, like starting the movement. Like once they get moving, they're okay, but they just
Right.
can't initiate it, like you were describing a little bit.
Right.
Um, the other thing, though, you said dopamine. So, and I never even thought of it. We hear today dopamine is kind of the thing for our mood and gets us excited for stuff. And then when you see patients with Parkinson's, they have this flat affect, right? They don't seem
Correct.
to have like highs and lows a little bit too, right?
Correct. Yeah, that's correct. Yeah, so it can affect like emotional lability, your mood overall. They tend to have more of a flat affect where they just don't have like the emotional component. Um, you can also see that they have like sort of what they would call a decreased blink rate. So their just facial expression is diminished. And they may not readily say that or their caregiver, but when you ask them specifically, do you notice that there's changes in his facial expression? Caregivers will often say, oh yeah, I have noticed that he just doesn't seem to be as expressive as he used to be.
Well, going back to someone that's been very like, he's been a proponent of the Parkinson's is Michael J. Fox. Like what he has, he's been out there. But he had it since he was 29 years old. That seems so
Yeah.
crazy to me. Like I don't
Yeah.
understand why he suffered for so long. This amazing talent and man.
Yeah. No, that is really sad. And it's extremely young. We really don't see individuals in their 20s or 30s or even 40s who develop Parkinson's. So his was a very rare case and it was very unfortunate. He
Yeah,
seemed to go through like these ups and downs though over decades. And I don't know exactly where he's at now, but I know that there were times where he seemed to be doing better.
right.
So perhaps they had, a stimulator placed, like a deep brain stimulator, which is a surgical, which is surgery, essentially putting a stimulator in the brain that can help with smoothing out these movements.
Yeah,
Have
I
you
mean, I
seen?
just can't believe he's been
Yeah,
alive with this disease for so long, but
Yeah.
he's out there showing everybody that he can still do things, or he was acting through it. It was amazing.
yeah,
Yeah.
yeah. Have you seen someone that young with Parkinson's?
No, I haven't. No, I'm probably the youngest I've seen is probably somebody in their 50s, like early 50s.
Yeah.
That's extremely young.
Yeah, it's almost like maybe we're missing part of the diagnosis, right? Is that possible? Like there's some other thing with him, or who knows?
I don't think so. I mean, I feel like it would have come out, over the years if he did have some other diagnoses. But yeah, I don't know, why. I think it really is just probably just the genetics, the way his body is, whatever that kind of spurred this on. Um, and, just bad luck.
I had this one during residency. There was this one vascular surgeon who nothing to do with Parkinson's, but he had this crazy tremor, and he was a vascular surgeon,
Oh,
and
wow.
crazy tremor, and you'd watch his hand shake until he got to the blood vessel. And then when he made it to the blood vessel, he was smooth and beautiful. But it was like the scariest thing watching him get to that blood vessel. And then when he'd get there, it was like
Yeah.
poetry. And I don't know what he had something like some weird tremor thing, but
Yeah, he probably had a bad essential tremor, which is always the thing you want to differentiate between that and Parkinson's, because an essential tremor, it's also called a benign essential tremor, an action tremor, or a postural tremor. So it's usually when you're trying to, you're trying to thread a needle or something. It's fine motor movement is when the tremor comes out. And some people are able to like control the tremor. They can try to relax or certain posture positioning, and then their tremor goes away. But that's what it sounds like. He probably had a benign essential tremor.
Well, so you explained Parkinson's is like more common in men, and then I was reading MS, which Christina Applegate and Jamie Lynn Sigler, they started a podcast called Messy, just about them dealing with their MS diagnosis. And I was wondering, so why is MS more prevalent in women? Is there a reason?
Yeah, I mean, we don't entirely know, but it is much more common in women versus men. And it typically is a young person's disease. So females, 20s and 30s is usually when it starts, or though sometimes people get diagnosed later for, other reasons. It's an autoimmune disease. So, as we know, like autoimmune diseases are just more common in women. We think that there could be a hormonal factor. We blame a lot of things on hormones, but essentially there could be, an estrogen factor related to that. And somehow with autoimmune diseases where your body, instead of identifying, like foreign bodies, like if you have an infection or something else in your body where your immune system starts attacking, it somehow gets misguided and miswired, and it starts attacking like your own cells. So in MS particularly, it's attacking your own, brain cells, the neurons and the sheaths that cover like your nervous system. So I think there's, the hormonal factor, the autoimmune factor, that
Okay.
makes it more common in women.
and what is MS?
So MS is multiple sclerosis. It is an autoimmune disorder, again, where your body starts attacking your own brain tissue and, your central nervous system. And over time, what happens is you have attacks that can happen as time goes on, and they can happen kind of sporadically. And when you do imaging in the brain and the spinal cord, you can see that there are like these abnormal plaques in the brain, which have to do with the attacks that happen as time goes on. So it is sort of a chronic progressive disease, but if you can identify it early enough and start people on treatment to help reduce or almost eliminate these attacks, that over decades of life, people can live a healthy, normal lifespan. Back when I was in training in med school and residency, we saw people who, unfortunately, at the time, we had very few drugs out there. And these drugs are, you know, we still use them sometimes today, but they're very old medications that weren't really doing the job, or people were diagnosed much later in life, or they didn't want to go on treatment for whatever reason. And so as a result of that, like they were very debilitated, wheelchair bound, bowel bladder incontinence, they just essentially were paralyzed because of all these attacks that happened throughout the course of their life. Nowadays, you don't see that anymore. We don't see people. It's very rare to see people coming in with a diagnosis of MS and coming in with a wheelchair and being completely debilitated, because we start treatment, we identify it early, we start treatment early, and people can lead normal, healthy lives. I mean, of course, there are other, it's a spectrum of disease, and we can never predict who's more likely or more prone to having a more progressive or aggressive course. And of course, there are situations where, scenarios where unfortunately some people just have really bad disease. They have spinal cord disease, which tends to be a little bit more aggressive because it affects their spinal cord and their motor functioning, etc. Or people who may not respond as well to medications. But now we have so many medications that are available. that it makes it complicated, but also it's great. It's great for patients to be able to have many options to choose from.
I have two MS questions. How do you diagnose it?
So the diagnosis is really based on their symptoms and whether or not they meet specific criteria for having these multiple attacks over time and space. It's through imaging. So we do radiologic imaging, MRI scans of the brain and the entire spinal cord. And then also, nowadays, we don't do it as much, but getting a spinal tap, a lumbar puncture to look at the spinal fluid to see if there's abnormalities in the spinal fluid.
So is there like a classic CAT scan or MRI look to someone? Like if you get a scan,
Yes.
you're like, oh, that's classic for it. Is there?
Yes, so there is. I mean, you have to put everything into consideration, like they're, based on their demographic and, their disease and things and their symptoms and all of that. But there is this classic radiologic imaging on an MRI scan that looks like MS. They have multiple this white matter lesions in the brain that kind of follow a certain pattern.
Yeah. I have patients often coming in, thinking, because I do a lot of thyroid and parathyroid surgery. So I have these patients all the time coming in saying, oh, I must be thyroid, hypothyroid or hyperthyroid. And a lot of that stuff sometimes sounds like it could be MS. And in the back of my mind, I'm like, do we need to send you to a neurologist? Like, how often should I be sending these people to you?
That's a good question. I mean, I think anytime there's concern, and the patient is concerned about it, nowadays everybody Googles their symptoms, and unfortunately, MS is one of the first things that pop up. So it really is hard to piece apart patient symptoms because if there's anxiety or other things, people can have numbness and tingling throughout their body. Really, MS is a disease where you have very specific attacks. So you have, an episode, it's usually not just numbness and it's not whole body numbness, but because you think about there's one part of the brain where you have a lesion that, pops up. And so that part of the brain causes specific symptoms. They could have a foot drop where their leg goes weak or their foot goes weak, or they have, difficulty using their hand, but it's usually like a lack of function that goes on for weeks at a time and then it resolves itself. Or they can have loss of vision in one eye, which is very concerning, or double vision, but it's true double vision where they have two objects side by side. And then that goes on again for weeks at a time, and then it resolves. And then years later, they may have another episode. So it's not usually the coming and going of symptoms like, I felt this weird numbness in my whole body, and then 30 seconds later it went away, but now I can feel it in my foot. And you know what I mean? Like sometimes you can start down this really this rabbit hole of symptoms where you start thinking about things and then now you have it. I had an attending when I was in training who would talk to patients about that. Like she was like, well, if I think about it right now, I've got a little numbness on my hand right now, and now I've got a little numbness in my foot. And it's kind of true, you can start sort of spinning. And so I usually talk to patients about that because I want them to pay attention to their symptoms and not ignore things. But at the same time, you can drive yourself crazy. And if it helps, I talk to them about let's just get imaging, let's just get an MRI scan. I think the likelihood is extremely low. I'd be shocked if we found anything, but just for peace of mind, I think it's a good idea to get brain imaging and make sure that we're not dealing with anything.
But I do see a lot of times in the my newsfeed brain games, things you can do to ward off dementia. Is there any games or things that you do, or is there any truth to any of that?
I mean, I think anything that you can do to exercise your brain, like any kind of organ system, like your heart, you've got to get it moving and pumping. I think in the elderly, it becomes more challenging because there's sort of less and less activity and mental stimulation. So I usually tell family members and caregivers that anything you can get that person to do whatever they enjoy, whether it's mahjong or Sudoku or reading, crossword puzzles, things like that. I mean, there's nothing really specific that I think that we found that is the key to uh,
Right.
mentally exercising your brain. Um, but people who have they're at work, involved, they've got structure to their day. I mean, I don't usually tell them, but they're having some mild cognitive issues. I don't tell them like, oh, when you go home, you should do an hour of crossword puzzle.
Yeah. How
Yeah.
often do you get, as a neurologist, do you get all the time your friends saying, I have a headache? Do you think it's a brain tumor? Do you get that all the time?
I get it a lot in the office. That's why they come to see me, is because they're concerned about having a brain tumor. I am part of a tennis club in our area, and so I have a lot of female partners that are not, they're not working, so they've got a lot of time. And so they do, yeah, so they ask me a lot about their neurologic symptoms, etc. And yeah, I think it's a common question, it's a common concern. So yeah, I do get that question a lot.
Yeah. I get
I've
it, and I'm not a neurologist, but you probably get it all the time.
I know, even like social events, parties. Yeah, I usually don't tell people that, this is like, I don't know about you, but I don't usually tell people I'm a physician or a neurologist, because then it brings on like, oh, well, I know someone who had this. And it's like, oh, okay. Not sure how to respond, but
Yeah.
yeah,
Did you watch The Pit?
I have. I've started watching it. I've seen a few episodes.
So what do
Yeah.
you think about they had the classic neurologist character on The Pit, right? The guy who came in and was just all about the jokes and the puns. Do you remember that guy?
No, that must not be early on. I think I saw like first 2 or 3 episodes.
Okay.
Um,
We talked about it on the show, and we've had one woman who's actually a nurse, who's actually an extra, but then got a decent role in The Pit.
oh,
Um,
nice.
so we reviewed The Pit on the show, but there's that classic so you'll have to watch it more to see the neurologist
No.
character.
Okay, I'll have to watch it and then we can do another podcast on it.
Exactly. Exactly.
Yeah. He's probably my favorite character. He's only in it for like 5 minutes, but he's got some good jokes. Some good
Oh,
Yeah.
really?
jokes. Yeah.
It's probably the classic, like, academic sort of
Mhm.
neurologist that it's the stereotypical neurologist.
He seemed to
Yeah.
have a little bit of comic relief almost in the
Mhm.
whole show. So it's
Oh,
like
yeah.
kind of break a little bit.
Nice.
Yeah.
You like the series, Jason?
That's an interesting question. I think it was amazingly done. It was a little traumatic for me to watch, as I think for most people. Like, it's just so intense. Like, it was like when I watch a show, I don't want something that intense. I kind of want to mellow out, and I kind of just felt like after each episode, I had to kind of like take relax a little bit.
Yeah. I hear you. I'm not big on medical shows for that reason, because I feel like you're just criticizing things or you're trying to analyze things a little too much. You just want something that's, I don't know, like takes you away from, your everyday sort of workplace.
Exactly.
Well, so that like kind of brings us to the end of our segment. We got two like last question. One is, what are you watching?
I don't know. I'll bounce back between a few series. Right now I'm watching this series called Dark Matter, which is on Apple TV. Have you guys heard of it?
Yeah, I've heard of it. I didn't know if I
Yeah.
couldn't tell if it was good or not, so I never clicked. But maybe I will.
It's interesting. It aired in June of last year, and then they're starting to film, or they just started filming the second season. But it's just one of those like sci-fi sort of shows where this guy is a scientist, and then he kind of creates these different dimensions, and
Mhm.
so you see him in these different dimensions of his life. He's sort of like trying to figure out a way to get back into his, real life. But it's interesting. I don't know. And then
Are you recommending it for us?
I recommend it though. I recommend it. I think it's well done. Yeah, I don't love sci-fi, but I like this series. And then I'm also watching The Summer I Turned Pretty. on Amazon. Have you guys seen that?
I keep seeing it on Amazon, like at like the little like clip whenever I click on Amazon, and I can't tell if I'd like that show either. You recommend it? I'll give it a try.
I like it. I like it. And yeah, and I don't necessarily love like these coming of age type shows, they seem a little young, but I thought this one was done pretty well.
So
So it's like,
are you
what's that?
team Maya or team the other guy?
Oh,
What's his
you
name?
watch it.
Oh yeah,
I'm watching it too with my two, because I have two daughters. Well, I have three daughters, but I'm watching it with two of my daughters. So, yeah.
I don't know yet. What are they? Who are they rooting for?
I don't know, but I'm team Conrad. I'm team Conrad.
Team Conrad is the older one, right? He's yeah.
Trying to be a doctor. He's the one who's
I know. In season 3, he goes to medical school. I was like, what?
Yeah, I know.
I am not sure. I'm like team nobody right now, so we'll have to see. Yeah.
I like her brother a lot too, actually.
I do too. I like her brother. Yeah.
Billy's brother.
Yeah.
Yeah.
I agree.
I'm gonna have to watch it though.
Yeah, it's cute. I like it. Jason, would you recommend it to Lauren?
Yeah, I think the first season was fun and great, and that I'm so intrigued by the North Carolina beaches because it takes place in North Carolina, supposedly.
Oh, it's beautiful. Yeah. I love the idea of them like with their families. They come together over the summer. So it's these two families that they've grown up together essentially. And every summer they spend at one of their homes, like their summer homes. And then as time goes on, the girl in one family develops feelings for basically both brothers and kind of goes back and forth and is sort of torn between the two. But I love like that feeling of being, I'm not that my life was like that when I was young. I didn't go to summer homes or, have crushes on these like, very beautiful, attractive boys. But I love the idea of it, I guess.
Yeah, it definitely is a fun show.
Yeah.
Maybe we could even have a summer I Turned Pretty episode and have Dr. Cook as a guest.
That sounds good.
You guys watching the finale together, just talking about it? Yeah, I can see that.
Yeah.
When the finales come, are you caught up? We're caught up.
I'm on episode 3, I think, and I think the season finale is in September because I have a bunch of mom friends here where they're all getting together during the week and trying to catch up. So I think the season finale is in September.
Okay, so we have another final question. Dr. Cohen runs a mentorship program, and so now we like to ask our guests if they have any like mentorship advice, or it doesn't have to be for future doctors, but it can be just for anyone, life advice.
Mentorship, interesting. Is this like for who's your audience typically for this mentorship program?
So, at Cedars-Sinai, I created about 10 years ago a pre-med program for college and post-bac students. So I created it at Cedars-Sinai. So you have to be 18, you have to be at least a freshman in college, but sometimes we have, I love talking about this 50-plus-year-old attorney who decided they wanted to go back to medical school. And sure enough, I didn't even want to take this person in the program, but everybody was like, well, why don't you just interview them? And so I did. And we took the person into the program. And I think they may even be done with the medical school already at this point, which is pretty cool. So,
wow.
One of the things I love to tell, one of my big regrets in life, I don't know about you, is I didn't take a gap year. I kind of was boom, 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 boom. And that's one of my regrets, is that I didn't slow down. Different things like that. I'll kind of.
I agree with that. I mean, I actually did do a year during medical school because I went to a combined program that essentially was going to be 7 years, like 3 years of undergrad and 4 years of medical school. So I ended up taking a year off. And I have to say, it was probably one of the, highlights of my life and my journey. And every time I think back to the time I had off, I did a little research, but then I also ended up in South America, I was in Peru for 4 or 5 months, and then Costa Rica for another couple months. And I was able to learn Spanish, and now I'm, fairly fluent. But just my experience, being in a different country, it really opened my eyes to just the world. I mean, I grew up in the suburbs of Chicago, and I had a very like sheltered kind of, my growing up years, I think, and it was just very eye-opening for me. And I wish, looking back, I mean, I wish I had traveled more. I wish I had traveled more in college. Um, and then I think med school is tough. Like that whole journey is tough. You feel like it's the end all be all, but then you end up doing residency and fellowship, and you're always trying to like get to the next stage of life. And so I feel like you miss out a lot on those formative years where you could have done other things, but I don't know. And I wish I lived in New York City. I wish at one point in my life I lived as a young adult in New York City, like being able to go out and do just cool things. Um, but it is what it is. I'm happy with where things ended up, and yeah.
No, I think that's a great answer. Travel more. I mean, same
And live
Dr.
in New
Combs.
York.
Yeah.
Yeah, I live in New York.
I'm from New York, right? Did you know that?
Are you? I didn't know that.
Yeah. I lived
Oh,
I grew up in the city, and then I went to med school and residency in Brooklyn.
oh, okay.
So I did that.
You did that. Yeah. You achieved my goal.
Yeah, and it was great. I agree. I mean, that was being in New York was great. It really
Yeah. I think it teaches you a lot of like life skills, teaches you to be, right? Like you learn to be street smart and fend for yourself.
yeah, it was great. Dr. Cook, you are amazing. I'm so happy
Oh,
to see you. I'm so happy you were a guest with us. This is definitely
okay.
going to be the first of many, I hope.
I
Um,
hope so too. This was great.
you're
Yes, thank
awesome.
you for answering so many of our questions. I really appreciate it.
Yeah.
Do we
Thanks for having me.